In the studio with Dr. Mona Kumar, clinical psychologist, here to talk to us about teenage depression during the pandemic. Welcome, doctor.
Thank you. Happy to be here.
Have you seen a rise in teenage depression during this pandemic? And if so, what exactly is causing the depression?
Good question, Michelle. So in general, the prevalence of depression varies from 10 to 20%. That means 1 out of 10 to 1 out of 5 individuals will experience depression at some point. And right now, in our teens, we're actually seeing numbers in the higher end of that range because of the pandemic, and in particular because of the social isolation that we're all experiencing, but that for teens is a particular risk factor. In addition, teens are also turning more towards social media, which when used in moderation can be useful. It can be a helpful source of support to compensate for ways in which they're no longer getting to interact with their peers directly. But when used to excess, it can actually start to contribute to their feelings of isolation and loneliness and become more harmful than it is helpful.
Very interesting. So how can social media contribute to loneliness and depression?
I think the main way it does this is by creating the illusion that other people are happier, having more enjoyable lives, getting out more, and all of these things start to create a sense of inadequacy and lack in the teen and make them question whether their lives are as good as the lives of the people that they see on their screens. And that ultimately then starts to reduce their sense of self-worth and contribute to higher rates of depression.
So what do you think, Dr. Kumar? Should there be a time limit on social media?
Absolutely, yeah. I think social media should be one part of your teen's overall day, but certainly not to the exclusion of all the other things that are important parts of a well-rounded day.
So what's the difference between teenage depression and normal teenage moodiness?
Absolutely. Good to be able to make that distinction, because we all know adolescents go through a range of moods, often within the run of a few hours or a day.
Because we've been there ourselves, teenagers, and we know the ups and downs.
That's right. So we can relate. We can
Yes.
remember what it was like. And a lot of that is very normal and not something that needs us to overreact to. But the two differences between depression and normal moodiness are duration and severity. Mm-hmm. So look at how your teen is feeling. If they are very sad and that has lasted for a period of at least 2 weeks, chances are they're experiencing something that's more clinical in nature rather than normal teen behavior.
So what can teenagers do if they are depressed?
Teens should do those things that make them feel good about themselves, within reason, of course. But if there is a hobby they enjoy, they should participate in it. If they're pursuing a skill that they're developing, it's a good way for them to feel good about themselves. It's also important for teens to confide in friends that they trust and to seek support from a grown-up that they feel they can talk to.
What can parents do to help their teenagers?
Well, good mental health starts with good physical health. So for starters, I think it's really important for parents and teens together to look at how a teen is eating, how they're sleeping, and what their level of exercise is, and to work on improving all three of those things. It's also important for parents at this time to talk to their teens. Let your teen know that you can see that they're out of sorts and invite them to share with you whatever they feel comfortable sharing. And just listen and try to understand. So don't try to minimize or offer a solution, even though you may be tempted to do that. The more a teen feels like you're just taking them seriously and hearing them, the more likely they are to see you as a resource.
Dr. Kumar, when is it time to seek professional help?
So sometimes working with your teenager alone isn't enough, and that's when it is a good idea to involve someone who can support you, because this is what they are trained to do. So in some cases that may mean a therapist, and if you do seek out the support of a therapist, it's great to look for someone who specializes in working with teens, because they are going to be more likely to be able to develop rapport with your teenager, which is such an important part of keeping them engaged and creating an effective therapeutic relationship. In some cases, your teen might also benefit from medication, so go to your pediatrician, go to your PCP, possibly obtain a psychiatric referral, because oftentimes medication and therapy can be very useful to combine in the treatment of depression. Most importantly, don't be deterred by your teenager. They may resist your increased involvement, but just know that they need you, even if they may not be asking for you to help.
Thank you so much, Dr. Kumar. And teenagers, we want you to know that we care about you, we love you. If you need help, please call the number on your screen. That number, 1-800-854-7771, or text LA to 741-741. And don't forget to check out elsegundo.org for all the latest and accurate information on COVID-19.